Hello, everyone. Good morning, good night, good afternoon. It's a pleasure for me to be here, invited by ECS Veterinary from Australia. My name is Dr. Rodrigo Zamith Cunha. I'm a veterinarian, primarily graduated at Brazil with a double diploma also from Italy, and worldwide researcher regarding the endocannabinoid system, the use of cannabinoids as a therapeutic tool within our veterinary patients. Today we're going to have a super really interesting chat regarding what is the endocannabinoid system that everybody's inside the medical care is talking about so much in the last 5 to 10 years. How it works very fast, how we can use it as a therapeutic tool, and I'm going to show you some interesting cases that I have. So are you ready? So let's go. So first of all, I think it's very interesting for us to understand when we're talking about the cannabis plant, right? We're gonna have cannabinoids. Cannabinoids, they're gonna be like, for example, the CBD, one of the most known molecules and most also research molecules nowadays, right? But the cannabis plant is also gonna have more than 100 other active compounds, such as, for example, cannabinoids, such as, for example, phytocannabinoids. The phytocannabinoids, they're called phytocannabinoids because they are exactly cannabinoids derived from the plant. Okay, so we're gonna have CBD, THC, the two most knowns. We're gonna have CBG, we're gonna have CBV, we're gonna have CBN, we're gonna have CBV, and then go on. And each one of those cannabinoids, they're gonna have singularly and individually an effect or many effects. And when they are put together in different compositions, different proportions, they're also going to have different effects. All right. And one of the very peculiar characteristics of the cannabinoids that we need to say is their biphasic effect. What I am meaning with biphasic effect, it means that in opposed doses, they're going to have opposed effects. For example, THC in lower doses, it's a stimulant from the cerebral cortex, and also it it's a very important to control central nausea. Whether in high doses, hyperacute doses, THC is going to be a depressant of the cerebral cortex and can promote hyperemesis syndrome. So we can see that opposed doses, they're going to have opposed effects. All right. And other cannabinoids are going to present the same. And we can talk about cannabinoids, about their characteristics and about the qualities and about their effects. So we're gonna have THC being the most known psychoactive. It's gonna be an excellent analgesic. It's gonna be an excellent antiemetic in the right doses, appetite stimulant, anti-inflammatory, and euphoric or anxiolytic, depending on the doses as well. And recent studies has also shown that THC combined with CBD is going to also promote muscle relaxant. CBD, the one most known cannabinoids and most researched cannabinoids, and one that we are going to focus today because that's why we are here, because we are now developing and promoting products specifically for high performance horses that by regulation cannot have THC. So we're going to focus majorly on CBD, that is a multimodal molecule that can have many different effects because can and will interact in different tissues and in different cells. And because of that, for example, with difference of the THC, that's why we're going to have different regulations. CBD is not psychoactive. It will have a strong and stronger than THC anti-inflammatory effect, antiemetic effect, analgesic effect, anticonvulsant effect, because matter in fact, cannabinoids still will have one characteristic in neuronal activity known as retrograde potential, because cannabinoids will interact with receptors in the both end of the synaptic fence, pre and post-synaptic. We're going to have anxiolytic effect of specifically of CBD. And therefore, we're going to have also other cannabinoids known as minor cannabinoids as CBG. We're going to have also anti-inflammatory. And for example, one of the major characteristics of CBG is by now, CBG is one of the only known cannabinoids to be an alpha adrenergic agonist. potential anti-cancer activity and analgesic effect. And we can go on throughout not only the phytocannabinoids, but also the terpenes that are the aromatic component of the cannabis plant, are also hold therapeutic properties. But then, once we are on hold of this basic knowledge regarding the molecules itself, and specifically here we're going to focus on CBD. CBD, it's proven for the last 5 to 10 years to be a safe molecule in many different species. So we're talking about horses, we're talking about dogs, talking about felines, talking about humans, and even wildlife. The safety range of the molecule itself can go from 0.1 to 10 milligrams a kilo, depending on the delivery system drug we're talking about. CBD mostly will have a very strong analgesic and anti-inflammatory effect. So therefore, we're talking about a single molecule with multimodal, both potential therapeutic effects. You can even, for example, associated CBD with NSAIDs or opioids in lower doses to, first of all, be a more effective protocol, therapeutic effective protocol. Second of all, be more cost-effective protocol. Third of all, by using reduced doses of NSAIDs, corticosteroids, or opioids, we also reduce reduce the risk of the incidence of side effects that we know that may happen due to the use of these drugs. So CBD, cannabidiol specifically, it's a water division how we treat our patients, specifically for pain management and anti-inflammatory effects. Not only that, they're also going to pursue, they're also going to have other effects already proven in literature, such as anti-tumoral effect. But that, of course, is going to depend on the type of cancer. We're already seeing that cannabinoids on gliomas, breast cancer, lung cancer, and skin cancer, they have not only palliative care effects, but actually anti-tumoral effects, because they're going to interact in the perox cycle or in the aromatase cycle that, for example, in breast cancer, are responsible for cell proliferation and malignancy. Said that, what are the therapeutic uses inside veterinary medicine? The therapeutic uses, they are going to be based on the endocannabinoid system itself. The endocannabinoid system itself is going to be the target specifically for those molecules that we talked about. CBD, for example. The endocannabinoid system, it's a biological receptor locker key system, right? Widespread in the body. And that's one of the specific reasons why cannabinoids, they will have different effects depending on the pathology, on the species that we are talking about, because of the reason that the target proteins of the ECS are widespread all over the body. The function of that protein target will depend on, first of all, species, second of all, tissues of interest in that the protein is expressed, third of all, cell of interest in the protein is expressed, fourth of all, cell compartment, fifth of all, healthy state of those cells. Because, for example, we know that in a normal non-cancer cell, in a healthy cell, CBD will not promote apoptosis, whether in a cancer cell, CBD will promote apoptosis. So that's a specific simile that we are so far is still not fully understand, but already known as to happen. As I told you regarding, we have many compounds on the ECS. We have cannabinoids, endocannabinoids actually, because we already have those molecules produced in self. We have cannabinoid receptors, and we have enzymes. They all make this incredible cellular signaling system, with the primordial function being to keep the homeostasis of the body. So you regulate immune function, will regulate inflammatory function, and go on. And these are the proteins, and this is a little bit the research that we do regarding it to specifically map those proteins on the specific species of veterinary interest in. So here, for example, we have CB2, CB1, GPR55, and TRPV1 proteins. All of those proteins, they are target for cannabinoids, all right? And here we have on the synovial lining of horses, muscles of horses, and endothelial of horses. all of those structures are essential targets in the daily routine of equine veterinarians. And now we can use that inside our daily routine. What's the overall indication of cannabinoids? Pain management and inflammatory management. So therefore, I can prescribe it for X pathologies that will involve pain and inflammation as an anti-inflammatory and an analgesic drug. Now, if I'm talking, will that molecule cure the pathology itself? Then there are other indications, of course. But we can for sure already know that indications will go beyond not only pain management, but also cancer management and palliative care, allergies, atopic dermatitis for small animals, for example, or skin diseases, skin conditions in horses, colic syndrome as an analgesic, IBD to control gut health, epilepsy. In horses, there is no case report of use of cannabinoids to control epilepsy, but we do have case reports in dogs and humans, and I do have experience in controlling that with in dogs, specifically associated with very low doses of phenobarbital and being able to take out completely the brometum. In cases of laminitis, if you can research, we had pursued a specific research to find the targets for those cannabinoids in the lamina hoof itself. And we are now going further, not only to verify the potential and the proven effect of cannabinoids to manage the chronic pain of those patients that are refractory to other on other therapeutic options, but actually also to stop the outburst of the lamina inflammation. That's an ongoing research. Regulation of autoimmune diseases, anxiety, behavioral problems. And of course, we're not talking about behavioral problems, and we're never going to talk about a miracle pill that you're going to give to our patients are going to solve their problems. Behavioral problems, they need to be addressed as they are, a multimodal complex pathology. All right, what the phytocannabinoids or cannabinoids they're going to do in an individual affected by behavioral problems, they will regulate the sympathetic and parasympathetic tones. All right, so it's stimulating and bringing back normal kind of neuronal activity and neurobiochemistry, but that by itself, without behavioral addressing, behavioral therapy management, will not work. And then, of course, we can go a little bit further and why we can use those kind of molecules for pain management, all right? Because you're going to have all those receptors within the pain pathways, not only in one pathway, but also in the stimuli, in the perception, and the transmission, and the perceiving, and how we perceive and how we respond to the pain, okay? And cannabinoids, they not only act and interact with cannabinoid receptors, but also going to act within opioids receptor. So therefore, the potential to be analgesic is further away than opioids. And matter of fact, in humans, cannabinoids are already used to counteract and to manage opioids addiction, exactly because they interact with opioid receptors without promoting tolerance or addiction. Anti-inflammatory power, we already know, we have studies already by Turner and by Yoko and by Adams from Kentucky, showing that not only in vitro but also in vivo cannabinoids can reduce interleukins, can reduce the production and liberation of inflammatory cytokines in the peripheral blood of horses. And they have shown that in vivo and also in vitro. And they will do that probably by COX-1, COX-2, and also by LOX. That's still, there's still a huge gap of knowledge that we know, but clinically we already know that they do under regulation of those pathways without promoting the same side effects of NSAIDs, of ibuprofen, specifically in high doses in long-term therapy. So it's a safe way of doing the same therapeutic performance. Anticonvulsive is specifically, just a second, sorry. Anticonvulsive is specifically because I told you about the retrograde potential because of the presence of those protein targets, not only in the pre, but also in the post-synaptic, not only the post, but also in the presynaptic neuronal action. And for PTSD, so behavior problems of animals with trauma, this is already know also specifically in human medicine how cannabinoids can help humans suffering with long-term chronic PTSD. And now I'm gonna show you I'm gonna show you interesting cases that I have. As I told you regarding, we have already pragmatic pointing to the use of cannabinoids and literature evidence of the use of cannabinoids in cancer. Now we are going for research, ongoing clinical trials for sarcoids. What we know already is that cannabinoids, they will interact specifically and regulate the production and the liberation of metalloproteinases. Metalloproteinases, they can have 9 types. Depends on the type we're talking about, they will have a direct correlation with the malignancy degree of sarcoids, because they will for sure degrade the tissue matrix of the skin and facilitate the permeabilization and local metastasis of those cells. And what I have seen so far in cases with fibroblast sarcoids, that using a specifically drug delivery system, we were able to reduce the sarcoid without recurrency. And why I'm talking about the drug delivery system, because we know that it's not only about having an efficacy, effective molecule, but also how you deliver that molecule to the organism. All right. In human medicine, we are now going to another level of drug delivery system, working with ribosomes, exosomes, and liposomes. So what we are doing now, we are developing a high technological product called nano-encapsulated liposomal cannabinoid, specifically cannabidiol, CBD. By putting the molecules inside the liposome and by pressure, then in a nano-encapsulation of those drugs, we enhance bioavailability, enhance absorption, and therefore enhance effectiveness in lowering the clearancy and also lowering the possible side effects. And actually, this kind of system, the drug delivery system, is being used in oncology, in human medicine, exactly because you will deliver to the tissue of interest with higher concentration. That's why it's called target therapy, because you're targeting in a lower range the tissue, having lower concentration peripherally and more concentration of the drug in the specific tissue itself. So when you're talking about chemotherapy, you will therefore lower also the incidence of side effects. And that's exactly what we see by doing this multimodal protocol of oral and local liposomal non-encapsulated cannabinoid. You're able to reduce the sarcoid, to reduce the nodular sarcoid of this mare after a therapy of 30 days. Further, with another case with multiple sarcoids of different types, nodular verrucous fibroblastic sarcoids, with the same protocol, of course, but with high doses, multimodal protocol, topical, and also oral, we were able in 15 days to have a result of the sarcoids without starting to reduce and other sarcoids starting to drop off the horse. Further molecular research proved that, in matter of fact, we were dealing with sarcoids with a specific degree of malignancy because of the artifact, because of the feature we found. And further, even research also pointed to specifically the expression of those cancer cells for protein targets of cannabinoids. What's the next step? the next step is to promote more in vitro study and in vivo trials, what we are ongoing to do. And since I also talked to you about the laminitis, what we are right now with our laminitis, if you search and we can of course leave that specifically subject for the next webinar. We already did some research regarding where those protein targets for cannabinoids are specifically distributed in the lamina. That's for specific hypotheses that we can, of course, reduce the ongoing development of the disease. But before of that, cannabinoids are for sure indication to improve life quality and control the pain management of those chronic, severe affected horses that are no longer responsive to traditional and other therapies. This was the case of a horse severely affected by laminitis. Severe affected by laminitis, also affected by PPAD with a rotation of 13-degree rotations in the left front feet. This patient was being managed for almost a year and the owners and the veterinary team already had tried many therapies, phenylbutazone, opioids, gabapentins, NSAIDs, and etc. But the pain levels and the pain response were not being able to manage anymore. So we decided to start a protocol with specifically non-encapsulated liposomal CBD from a dose range from 0.2 to 0.5 milligram per kilo in a specific protocol. In 24 hours, we already had clinical results of pain management. As you can see in this video here, this is the video pre-therapy. This is the video 2 days after therapy, video 3 days after therapy, here 7 days after therapy. Here, of course, we can verify the reduction in laminitis, the improvement in weight bearing in both front feet, and the enhancement of appetite. And furthermore, we can also verify the improvement in rider behavior. You can see the reluctance to move, non-function of the left front feet. And then you can see already no reluctance to move. Of course, he's still lame, but he's moving better. Here is just a static representation specific of the improvement of the pain management of this patient in a time frame of only 7 days. And this just to showcase to you the degree rotation specifically of the left front foot. So, and actually what we've seen here is that we've seen an activity in a tissue that's very similar to one another, because we already know that the lamina, the hoof of the lamina of the horses, it's actually specialized skin. So the hoof of the lamina is very closely related to the skin of horses, and we are seeing the same. We are seeing a very interesting action of cannabinoids in those kind of tissues. Of course, there's more and further to develop and to verify regarding the specific action of cannabinoids within specifically pathologies. But by now, it is already known that cannabinoids can and will be used by not only veterinaries but also physicians to improve healthcare, where specifically traditional and allopathic therapies failed. I'm gonna for sure leave all of this specific data for further discussion, not only in our next section of questions and answers, but also in our next webinar. If you are interested in knowing more, not only about the cases I presented to you, but also regarding cannabinoids itself in prescriptions, please do not hesitate to contact me. And if you are more even interested in knowing what's the kind of product we are working on nowadays, we can contact directly Anita or Veronica from Endocannabinoid System Veterinary Center. We are working closely together with them and with Equiseutica. Thank you so much. And I hope it is very short, although very rich session may bring to you some clarity and some introduction of the potential of cannabinoids in equine medicine and to improve the healthcare of our patients. Thank you so much and see you next time.